ever Googled how many eggs you have left over at 2 a.m. in the morning and the result you got left you more confused than when you started? Yeah, we need to talk about that. On today's episode of Conceived, the podcast, we are breaking down ovarian reserve, what it actually is, how it's tested, and most importantly, what do you do with that information? Because knowledge isn't scary, not knowing is. Welcome to Conceived, the podcast with me, Dr. Kady, where empowering women with medical truth about fertility and pregnancy is my passion. I'm Dr. Kady. I'm a family clinician, board certified with a special interest in reproductive medicine, antenatal care, and women's health. And today, we are talking eggs, ladies. Let's start with a number that surprises almost everyone. You are born with all the eggs you are ever going to have in your lifetime. Not some of them, literally all of them. Are you ready for the surprise number? Here it is. 1 to 2 million of them tucked away in your precious ovaries before you took even your first breath here on planet Earth. By the time you hit puberty, that number would have dropped all the way down to 300,000 to 500,000 eggs. That's even before you become into your own at the stage of puberty. And by the time you start your periods, your body is doing a monthly selection process, recruiting a batch of follicles, maturing a bunch of eggs, and releasing one of these eggs during the ovulation process, and letting the rest of those follicles that were recruited for that cycle that contain eggs within those follicles themselves just die off naturally. Here's what most people don't realize. For every egg you ovulate, 1,000 others are lost in the background, not through your periods, but through a natural process called atresia. This, for you ladies, has been going on your entire life. So by your mid-30s, you are dealing with a significantly lower number of eggs than you had when you were 25. And by your 40s, the number drops steeply. And the quality of eggs becomes just as important as the quantities of eggs in your 40s. Now, I want to be very clear. Fewer eggs does not automatically mean that you cannot conceive. Those of you who follow me on my channel over on YouTube, Hey Doc by Dr. Kady, you will realize that I do a lot of content informing women who are over the age of 40 how they can go about getting pregnant whilst keeping them very grounded with focused information about medical truth and medical realities. So I'm not saying that having fewer eggs automatically means you cannot conceive, because the truth is there are some women, a small percentage of women in their 20s who have fewer eggs because of some genetic or biological condition that they have. They in their 20s have fewer eggs, but many of them are able to conceive. Having fewer eggs just means that the window for getting pregnant may be narrower. And it's worth knowing where you stand early on in your journey to trying to fall pregnant, particularly if you're 35 and older. Now, let's talk about what is ovarian reserve. So, whenever you hear the mention of ovarian reserve, what we're talking about medically is the quantity of eggs that you have left over, but also the quality of those eggs that are left. Your reproductive potential, essentially. Unlike a lot of things in medicine, we have a pretty good tool to assess ovarian reserves. There are 3 main ones, and I want you to know in this podcast what those 3 are so that you can have an informed conversation with your doctor. Number 1 is AMH, also known as anti-Müllerian hormone. This is a blood test, and it has to be the most useful single marker that we have. AMH is produced by the small follicles in your ovaries, so it gives us a good real-time snapshot of what your egg pool is. It doesn't fluctuate across your cycle, which makes it reliable and convenient. And you can get this blood test done any day. It doesn't matter which part of your cycle or which day of your cycle you're on, you can get that blood test done whenever. A higher AMH means you have more eggs in reserve, whereas a lower AMH just means that you have a smaller pool. But now, this is crucial. Get this. Your AMH doesn't tell us the quality of the eggs that you have in your ovarian pool within each ovary. It doesn't tell us how good your eggs are. So you can have a low AMH and still conceive naturally. On the other hand, you can have a high AMH and have high degree of fertility challenges. Why? Because though you have a high AMH, the quality of the eggs that you actually have in your ovaries, the DNA blueprint within your eggs, are not good quality. So making those eggs at high risk of miscarriage, or they are failing to implant because they are not able to propagate or grow adequately once fertilization has happened, just because the quality is not good. It's a piece of puzzle, I know. The second tool that we use to tell us about ovarian reserve is antral follicle count. This is done with the use of a transvaginal ultrasound, and your doctor will count the number of resting follicles that you have in both ovaries. And it's usually best to do this ultrasound on day 2, 3, or even day 4 of your cycle. The bottom line is it's best to do this at the earlier days of your cycle. I would say up to day 4, maximum day 5. An antral follicle count of 10 or more is usually reassuring. Under 5 or under 6 is usually a number that will raise flags. The antral follicle count, I would say, is complementary to your AMH. It either supports or it can challenge the AMH result. Tool 3 is the follicular stimulating hormone. It's an older marker, but it's still used because it's still helpful, and we can do this in form of a blood test, and it's usually done between day 2 to day 5 of your cycle. Again, done at the earlier stage of the cycle. So here's the logic behind using FSH as a tool for ovarian reserve. As your ovarian reserve, as the number of eggs in your ovaries decline, your brain, which releases the FSH, has to work harder to tell your ovaries to recruit more eggs during a specific cycle. This means it will pump out more FSH to do the job. So if your FSH is low, it means that things are taking away quite nicely. You have to remember that FSH is often done alongside your estrogen levels. And so if your estrogen level is high, it can often suppress your FSH. But this suppressed FSH that will give you a low FSH level will be falsely reassuring, because your high estrogen level is artificially lowering your FSH. So you get a low FSH and it gives you this sense of, yay, my ovarian reserve is okay, everything is good, but that's not actually correct. That is why all of these 3 tools that I've described should be done in combination, because they will all help to confirm the state of your ovarian reserve. So if you have a low FSH together with a good antral follicle count and a good AMH, these will all 3 be reassuring. And if one of these tools is completely out of the range of the other, so let's say, for example, if your AMH is high, but your FSH is really high and your antral follicle count is low, these are all contradicting one another. So usually if an FSH is high, it means that you have lots of eggs in your ovaries, right? But if you do your blood test and your FSH is high, meaning that your brain is working really hard to release lots of FSH to tell your ovaries to make more eggs, it essentially means that you don't have enough eggs. And then you do the ultrasound, and then the ultrasound shows that you don't have very many eggs in your ovaries. You see, the AMH, the result of a high AMH, is really contradicted by the other 2 results. So that's why it's ideal, if you really want to know what your ovarian reserve is to employ all 3 tools. It would be clinically irresponsible of me to talk about ovarian reserve without having the age conversation. So ladies, let's talk. Ovarian reserve and age are deeply linked. Fertility starts to decline in your late 20s, more noticeably in your mid-30s, and significantly from 37 to 38. By 40, the decline in the quality and quantity accelerates. Now, I'm saying this not to cause panic to creep up on board, but because I believe that women deserve to know this reality, not when they are sitting in the fertility clinic, sitting in front of a fertility specialist, wondering why nobody had given them this information earlier on. Age affects egg quality because of something called aneuploidy. This is when the egg contains the wrong number of chromosomes. At age 25, 10 to 20% of the eggs may be chromosomally abnormal. By the age of 40, 50 to 80% of your eggs will be chromosomally abnormal. This is behind the reason why the miscarriage rate increases the older the woman is, and why the IVF success rate is lower the lower the MAMH value ends up being. As a Christian doctor, here is what I want you to take away. Age is not destiny. Women for centuries have continued to conceive naturally in their mid-30s and even in their 40s. I mean, naturally. What age does is that it changes the odds of that happening naturally. Knowing this, ladies, helps you to make informed decisions, whether you want to be trying to get pregnant sooner, whether you want to go down the route of freezing your eggs if having a child now is not socially suitable, or you haven't found the right partner, or various different reasons, or whether you should seek support earlier, or very simply just understanding why things have been taking longer for you. Who should get tested? This is a question I get asked often in my clinic. So right here on Conceived, the podcast, let me give you a clear answer. You should consider testing your ovarian reserve if you are over the age of 35 and you've been trying for 6 months and longer, and if you are 35 and older and you are planning to get pregnant within the next year or two. If you have been actively trying to fall pregnant naturally and it hasn't happened for you for the past 12 months and you are under the age of 35, you should consider getting your ovarian reserve checked. Remember, let me go through the criteria again. If you're 35 and older and you have actively been trying to conceive naturally over the past 6 months and it hasn't happened over the past 6 months, you should get your ovarian reserve checked. If you are under the age of 35 and a year or longer, for those who are under the age of 35, you should consider checking out what your ovarian reserve is. You have a family history of early menopause, so either your mother or your sister went through the menopause before the age of 45. You have had ovarian surgery, either to remove a cyst or to treat endometriosis. If you have one single ovary, if you have undergone chemotherapy or radiotherapy at any stage in your life, particularly if you have had that done within the past year. And finally, if you are curious, just have a general curiosity about what your fertility is. Where do you stand in terms of being able to conceive naturally? And you would be surprised. This last cause of finding out what your ovarian reserve is, being just curious and knowing where you stand in terms of your fertility, is a very valid one. Ladies, let's change our mindset. You do not need to be actively trying to conceive. And this goes for Christian ladies out there who say that they are waiting on God to bless them with their husbands and they are just not investing in their fertility. They're just chillaxing, not doing anything. Ladies, you need to find out what your ovarian reserve is, because if you are waiting on the Lord and you are 31, 32, and you do your AMH and check out your ovarian reserve and your ovarian reserve is on the lower end of normal, then you will need to be taking proactive steps like egg freezing so that you do not miss out on the boat of, becoming a mother one day. Once, God has eventually sent you your husband or you've met the right partner, you don't miss out on motherhood just because you didn't do the right thing when you were not actively trying to get pregnant. It's about fertility awareness. If you are aware about your fertility, then you can take the right steps early. Remember, for us women, our fertility, time is of the essence. Low ovarian reserve. Okay, what does it actually mean? What's the implication for your fertility? So let's say you got your results back and your antral follicle count is low. Remember, the antral follicle count is how many eggs or how many follicles you have in your ovaries. What happens next? Okay, first, breathe. A low ovarian reserve is not diagnostic of infertility. It doesn't mean that you are infertile and unable to have children, full stop. That's not what it means. It just means natural conception may take longer, may be more challenging. And with a low AMH, a low ovarian reserve, if you decide that you're going to go down the route of assisted fertility with IVF, it just means that your response to the medication to stimulate your ovaries might take longer, and you might need a higher dose of those medications. And so with a lower AMH, your doctor might have to adjust the IVF protocol so that we are able to stimulate your ovaries enough in order to get those very few eggs that are remaining. What it does not mean is that you cannot conceive naturally. No, let me correct that misconception. There are some women whose AMH have been so low that they could barely be identified on the scale, who have gone on to have natural conceptions. Individual variation, ladies, is real. However, a lower ovarian reserve just means that for you, time matters more. In comparison to another woman with a higher ovarian reserve results. So all of her 3 markers are in line and on the side that she has a good ovarian reserve. So for you, your window of action is shorter and you must know it and you must take action quickly. So with the diagnosis of a low ovarian reserve, your doctor might recommend any of the following: trying to get pregnant sooner rather than later. If you're not ready to get pregnant, your doctor might recommend considering egg freezing. Your family doctor, if this diagnosis is being made, or when I say diagnosis, if your family doctor is the one that tells you that your results are in line with low ovarian reserve, your family clinician might recommend you seeing a reproductive specialist sooner rather than later. And your doctor might do a lifestyle review, because things like smoking, poor sleep, highly stressed lifestyle, no exercise regime are all things that can accelerate follicular loss. And remember, your follicles in your ovaries actually contain the eggs that may be released during ovulation. Speaking of lifestyle, it is worth noting that supplements like coenzyme Q10, DHEA, and other antioxidant supplements like vitamin C have been studied in the context of improving the quality of the eggs, especially in women who have a low ovarian reserve. The studies are still evolving, and it's still early days in making this an evidence-based and solidifying the findings that these supplements surely, and it's solid information that they improve the quality of the egg. We are still in the process of making those researches, but many reproductive specialists do certainly recommend the use of coenzyme Q10, particularly in women over the age of 35, especially if they are 40 and older and actively trying to get pregnant, and also if they have a low ovarian reserve. Just a quick word on premature ovarian insufficiency. Premature ovarian insufficiency is underdiagnosed and misunderstood. It's also called POI, and it's when the ovarian function significantly declines before the age of 40. Now, get this, it's not the same as early menopause. Many women with POI still have follicles in their ovaries and can even conceive spontaneously. I mean, naturally. But the rate and the likelihood of that happening is much lower. It affects 1 in 100 women under the age of 40. So it's fairly common. It does happen that women with POI can have regular periods, but it is less likely to have a woman with POI with regular periods. It often presents with irregular periods. Other symptoms can include low libido, hot flushes, brain fog, and one thing that causes these women to seek help is the fact that they are having struggle and difficulty conceiving. If you're under the age of 40 and you're experiencing any of the symptoms I have just described, see your doctor. Your doctor must do an FSH blood level, so a follicular stimulating hormone blood level, and a result that is consistently above 25 to 40. So above this range for the two separate tests, and you need to do the FSH 1 month apart. So you need 2 FSH tests, one done month A, and then the second one done in a separate month at minimum of a month apart. Getting levels consistently above this range of 25 to 40, alongside having these symptoms, points towards the diagnosis of premature ovarian insufficiency. And this, ladies, will warrant further investigation. So if you are informed, you know this information, you get tested early, you're not trying in vain at trying to get pregnant and failing and suffering frustrations just because you do not have the knowledge. Premature ovarian insufficiency is real and is the reason why a lot of you are not getting pregnant, even though you're under the age of 40. Remember, POI is not the same as early menopause. It's not. I couldn't do this episode without acknowledging something that isn't in any textbook. It's not theory, but it's real. And that's the emotional experience, the emotional turmoil that any woman that finds out that she has a low ovarian reserve unexpectedly could be going through. It can feel like a loss. It can feel like your body has let you down, especially if you are a Christian woman out here and for you being sexually intimate outside of marriage is out of the question and you waited on God and it just didn't happen for you and you are now finding out this information when you are told that your ovarian reserve is low. It can feel like time has been stolen from you. You can be asking God a lot of questions to the extent where it is very possible to be angry with God. I want you to hear me clearly. Those feelings are valid. They are real, just as important, and they make sense. For many years, women have tied a lot of their identity, their self-worth, their plans, their future to our fertility as women. And getting news that complicates that picture is genuinely hard. But can I put a twist to that reality, ladies? A test result is a snapshot. It is data. It is not your reality. It's not your story. It doesn't define your journey. I've sat with women who have not gotten very good news when it comes to their fertility test results, and they've sat with me sobbing and have lost hope, only some years down the line or some months down the line to be holding their precious child or to have a growing bump in front of them. I have sat and I've heard the story of women who have decided to go down the route of egg freezing, and after a certain age, they manage to conceive. So there is no single path. There is only your path, informed by the best information that you get. And that's why I have decided to do this podcast, to empower you through information. Okay, let's wrap it up with a key takeaway from today's podcast. You are born with all the eggs that you are ever going to have in your lifetime. And this number of eggs will naturally decline throughout your life. Ovarian reserve is assessed through 3 specific tests: AMH, antral follicle count, and FSH, all ideally done together and not in isolation. Age affects the quality and the quantity of your eggs. This is not scary, but information empowering you. If you have risk or have concerns, speak to your doctor. You don't have to wait until you are trying to conceive to get the information. If you have been helped and you have liked this podcast, please share it with someone who you feel needs to hear this information. Please leave a review on whichever platform you're listening to this podcast on. It genuinely helps to get this information out there to more women that need to hear it. And you can find me on YouTube at Hey Doc by Dr. Kady. And there I break down these topics in a lot more details. I have lots and lots and lots of content there on reproductive medicine, women's health, and antenatal care. I'm Dr. Kady Diabagati. Take care of yourself, and we'll see you in our next episode. This is Conceived, the podcast.